And now we're going to talk about the #1 barrier to delivering healthcare, which is the global shortage of health workers, particularly nursing. So I'm Dr. Kate Talenko, and I'm the founder and CEO of Appleseed Education, which is an EdTech platform for scaling up African nursing schools. Next. So there are pain points in two areas. The health sector has the pain point in that the shortage of nurses prohibits both the private sector and the public sector from expanding. It reduces revenues, increases risks, it increases morbidity and mortality. We know that in Africa, nurse vacancy rates are 30 to 55%. The demand for nurses is expected to increase by over 100%, in the next few years. Africa has 25% of the global health workforce burden, but only 4% of the global health workforce. So there's a complete mismatch between the need and the number of health workers to deliver that care. The WHO estimates an 18 million health worker shortage by 2030. I was actually the co-principal investigator on that study. And for every additional patient that a ward nurse has, the mortality of all of her patients increases by 7%. There's a lot of evidence that the more patients a nurse has, the lower the care is for all of those patients. Next slide. And of course, African nursing schools would love to train more nurses. They would love to solve this problem, but unfortunately, they're not able to. Based on my 20 years experience working with African nursing schools, they just aren't able to meet the demand. Most of them are small, owner-operated. Most of them are less than 20 years old. They have little or no access to online learning, education software, information systems, professional management, capital for expansion. For nursing, there's an incredible faculty shortage. Most nurses globally are trained at the diploma level, but in order to teach, you need to have a bachelor's and a master's. So a nurse shortage is the nurse instructor shortage is kind of baked into the regulation. And also many health professional schools, including nursing schools in Africa, have extremely high dropout rates, as high as 60% between enrollment and graduation. So that's basically a loss of 60% of the nursing capacity in Africa. Next slide. And so my team and I, understanding these two challenges, we've designed Appleseed as an EdTech platform that will solve this shortage both regionally and globally by supporting the nursing schools in Africa to improve their quality, their efficiency and profitability, because they are businesses, whether they're public or private, scale their existing programs, and add new programs such as nursing master's programs, leadership, specialty programs. Next slide. So to understand a little bit about why now? Why is now a good opportunity? Well, first of all, COVID made everyone aware of the acute on chronic nursing shortage. So people are now ready to move, whereas they weren't before. And COVID also sped online learning. One of the things you can see it as doing is moving nursing schools in Africa from the outdated model of education to a more advanced digital model of education. Also, high-speed internet has improved vastly in Africa in the past few years, with Google laying down some ocean floor cable and making it much softer, much more affordable and much faster. And also, student loans are now available in Africa. That was one of the big bottlenecks, that governments didn't have enough money and extended families didn't have enough money to train people to be nurses. Once you're a nurse, you basically have a job for life. Next slide. And so to understand the ecosystem of the nursing schools, there are about 5,000 nursing schools in Africa, both public and private, a mixture of small, medium, large, and their cost structure right now, it's very expensive, whether it's for establishment or for expansion. They need land, buildings, computers, equipment, labs. They need health facilities as well for their students to practice in. They also have high operational costs or recurring costs, staff salaries, utilities, internet, insurance, placement computers and equipment, simulation mannequins, facilities maintenance. So it's a very expensive system as it is now. Next slide. And so our business model, how do we solve this challenge? We have three basic types of services. The first is a subscription service. So this is a web-based service. It's a single sign-on platform that allows them to access webinars that will give them advice and help them on every aspect of running a health professional school. A school document libraries, all the type of business plans, documents that they need. Group procurement. You're probably aware that every hospital in the US is part of a group procurement program. They usually are able to negotiate about 15% off. And most of these small nursing schools, they don't even have a professional procurement officer. So they really pay top dollar and get the lowest quality and lowest service for everything they buy. We also will have contract services, which are basically sort of outsourced services for any type of function of a nursing school. So if a rural nursing school is unable to get new instructors for a program, we can get those online, or we can recruit them for them. Or if a school is unable to do admissions in an appropriate fashion, we can do that on a fee for service basis. And then the final service that we offer is online program management. This is a function that's been very successful in the US and Europe, and has also been successful in Africa in the last few years, that we would help put either their existing programs online, new programs online, or give them access to existing programs in Europe or North America. And we do this on a revenue share. So there's no risk for the school up front. They don't have to pay anything up front. But if the program is a success, depending on the amount of effort each partner put into it, we have a revenue share. Next slide. And so this is just a visual example of our business model. Appleseed is at top. We provide the services, the platform services, the outsourced services, the contract services, the online program management. And then our revenue streams are the annual membership fee, which is for the subscription services. And we put a lot of effort into designing this so it's affordable, and tested it with a lot of deans. It basically, for most schools, will be 1 or 2 annual tuitions for that school. So it's very affordable. And we're able to show most schools that within a year, they'll recoup that cost. And then we have the group procurement. We will keep a portion of the money that's saved, the contract services I mentioned, and also the revenue share. So those are our 4 streams of revenue. And also there's a potential, if we want later, to go into recruiting the health workers that graduate from the schools and get the recruitment fees. And that recruitment could be local or global. Next slide. And so this is a market size. So based on 5,000 schools, we believe that within 5 years that we can get 25% of these as clients. I mean, we actually have conversations at the government level with several countries, including Sudan and Somalia, to have the government pay the fees and just bring all of the schools on the platform. So if we hit that 25% penetration, we'll have over 1,000 schools on the platform. We're predicting an average revenue of $220,000 per school per year, and I'll show a breakdown of that later. And so that would give us an addressable market size of about $275 million per year. Next slide. And so this is the customer unit economics. This is an actual school, St. John's School of Nursing. It's owned and run by a family. It's in rural Uganda near the border with DRC. And so the fees that we would get on an annual basis from them would be $5,000 for the annual fee. The revenue share, we're predicting that within 5 years that we would be getting about $200,000 a year for them. So if it were, like I put it here as a 40% margin. So if we were able to help them get $500,000 more in revenue a year, we would keep $200,000 of that. Group procurement fees, we're estimating at $5,000 a year for them, and the contract services for this we estimated on the low side at $10,000 a year. Next slide. So to dig in a little deeper on how we provide these services, the platform services are available, online through what we call the Dean's Dashboard, which is a single portal, single sign-on to access all of the services. When I speak about software, school management software, student management software, we are not creating any new software. This is all white labeled software. They're very good, cost-effective systems out there. It's just these African schools don't have access to them. So we've negotiated to give them access, and they'll be able to access the software through our portal. And we'll also have webinars offered multiple times a week on any subject that the schools are interested in, increasing their faculty.
Trusted nurses school pipeline,
working on accreditation, really anything that they're interested in. Next slide. Yeah, so this is just a mock-up of the app for people who would want to use it on app. And part of the onboarding process, every school undergoes an evaluation, is able to set their goals as far as increasing the number of students in existing programs, decreasing dropout, adding new programs, or improving operational efficiencies. Next slide. And this is just a list of all the services available on the platform, like the shared faculty, shared curriculum, the educational software, the marketing support, management support, and we can send the presentation to everyone afterwards. Next slide. Next slide is just a little bit more detail on the outsourced services. These are contract services. Could be admissions, management, administration, curriculum, teaching. Nursing schools are actually quite complex businesses with a lot of moving parts. And so these contract services will help with that and help them be more efficient and basically be their back office so that they can focus on their students and focus on teaching. And then, the online program management, as I said, can be third-party courses or can be the school's own courses. Next slide. Actually, you can skip the next slide because I think we've covered that. Yeah, just skip it. I think we've covered that. So for market traction, we have letters of interest from 16 schools in 6 countries. We're starting with Anglophone countries, and because the country is Anglophone doesn't mean that that's the main language. It means that the nursing schools teach in English. And just with these schools alone that have signed on a letter of interest, we would get about 80,000 in annual fees, and we estimate 1.6 million revenue by year 3 just with these 16 schools. Next slide. So our partners, Lecturio is the leading online educator of physicians and nurses, and they have given our partner schools deeply discounted access to their platform. Rife International is a U.S. African solar energy company, and they're going to give discounted solar energy systems to the schools because cost of electricity and also interruption of electricity are huge challenges for nursing schools, especially if they're going to do more digital learning. American Tower Company is one of the leading builders of cell phone towers in Africa, and we'll be working to site towers near our partner schools. We also are working with the West African College of Nursing, the International Council of Nurses, and International Confederation of Midwives to help reach out to nursing school regulators and to nursing schools and getting them on board. Next slide. So competition analysis, we really have not found anyone, public or private, who's doing anything like this. As background, I'm the former head of the U.S. government's Global Health Workforce Program, the former coordinator of the World Bank's Africa Workforce Program. So I'm very familiar with everybody in this field, and there's just no one, whether a donor or not, doing anything like this. I mean, in a way, maybe consulting companies, are competitors. I really don't see that. There is a private equity-backed medical school in Africa, but they have been unable to expand. I think they've been around about 15 years, and they only have 2 campuses. And there are also some other schools that have outside support, but they really have not been able to expand rapidly. So we think that the solution is working with the existing schools and bringing them up rather than trying to start new schools. Next slide. So we're asking for 500,000. This will get us our core team hired, get our contract signed with our core partners and vendors, get our MVP, which we currently have launched, get those 16 schools onboarded, get at least 1 curriculum content provider onboarded, build out that password protected platform, 1 round of group procurement, and at least 3 OPM programs under development, and we're calculating profitability by year 2. So the next slide is the revenue projection. And we're predicting 40 million by year 5 and 72 million by year 7. You can skip the next slide. Skip the next one and go to impact projection. So we're predicting by year 5, we will have improved over 1,400 schools. We will have impacted over 1 million students. So those are the number of students who had been in the school, passed through the school since we were improving them. Over 100,000 dropouts prevented, and over 200,000 new seats created, and over 1,000 new nursing programs opened. Next slide. So our team, we have an excellent team. Our chief of staff is a superstar, Dr. Ala Dafala. She's the first Rhodes Scholar from Sudan ever, which tells you a lot about her. She's also formerly on the board of the World Federation of Medical Education, and also as a liaison officer for education for the International Federation of Medical Students. So she understands a lot about health professional education. Next slide. We have 2 incredible advisors. Amit Savak is the CEO of ETS, which is the maker of TOEFL. He's a former VP within the Laureate system, which at one time was the largest private university system in the world. Luis Lopez, a former Laureate CEO, is the past CEO of Honors United University, which is the largest private university system in Africa, and is private equity backed. So that's it for now, but I'm sure we have lots of questions because this is a very, very complex market.